Hello medicos, welcome to our channel BackBenchersMed. Here we are with a new topic, primary open angle glaucoma. It's a very important topic and favorite topic of the examiners. Question come in 10 markers, 5 markers, and parts of it comes in 3 markers also. And MCQs also are abundant from this chapter. So let's start. So firstly, we have divided the chapter into two videos. In this first video, we'll learn about the risk factors, the pathogenesis, the signs, where IOP is a very important sign. Then we'll learn about the optic disc signs and the laminar dot signs, the bayoneting sign, the retinal nerve fiber layer defects, and the peripapillary atrophy. Then we'll learn about the symptoms. And in the next video, we'll learn about the visual field changes and the anti-glaucomatic drugs or the treatment of it. And it's very important in our videos that we use mnemonics, so it will help you to remember things instantly in the exam hall. So let's start without any delay. In the risk factors, IOP is one of the most important factors. So as the name glaucoma comes, so the IOP comes. The increased IOP is one of the most important factor. Then in family history, genes associated are optineurin. Ophthalmology is the subject, so optineurin is the gene. Okay, myocilin WDR36. It's more common in old age after 50 years, and diabetics and hypertensives are at great risk. So you need to remember three things: IOP, diabetics and hypertensives, age above 50 years, and if you can remember the family history genes, optineurin, myocilin. Okay, now next in pathogenesis, what is the cause of this disease, why this disease occurs? Okay, so here is reduced aqueous outflow facility, which occurs due to failure of aqueous outflow pump mechanism owing to trabecular meshwork stiffening and apposition of the Schlemm's canal wall. So see, after old age, after a certain age, there is stiffening in the trabecular meshwork, and due to that there is apposition of the Schlemm's canal wall. So it's difficulty for the aqueous outflow, and hence the IOP increases. So this is the pathogenesis of primary open angle glaucoma. Okay, so now let's get to the signs. So one of the most important signs, or the only sign that we can see through a measuring short tonometer or applanation tonometer, it's the IOP. Okay, so since the IOP, there has to be a range to measure it. Okay, so the IOP needs to be greater than 21 mmHg and a more than 5 mmHg difference between both the eyes, and there is diurnal variation also. I will show you the diurnal variation in the graphs, but firstly let's just remember the IOP must be more than 21 mmHg and more than 5 mg difference between both the eyes. Okay, so in diurnal variation, as you can see in the graph, there is a slight morning rise in few of the cases. Sorry, it's in 20% of the cases we see morning rise. Okay, in 25% of the cases we see afternoon rise, as you can see in the graph, and in 55% cases we see biphasic variation. What is biphasic variation? At 9 am the IOP is less, again in 3 pm the IOP is more. So like this it varies. Okay, the variation occurs. Next we have the optic disc signs. In the optic disc signs, there is loss of the neuroretinal rim, NRR. So initially it affects the infratemporal NRR, and lastly it affects the nasal NRR. So the infratemporal NRR loss is called polar notching. Okay, polar notching. And in vertical cupping, we can see the nerve fibers are damaged and are lost in the neuroretinal limb, which causes enlargement of the cup called cupping, and the cup to the disc ratio is 0.5. So when you see a fundus picture, we can see that there is a disc and a cup. The cup is small and the disc is big. The cup is inside the disc. Okay, so this is a normal cup to disc ratio, which is 0.3 to 0.4. Okay, next we can see an abnormal cup to disc ratio. Here the cup size increases. It's 0.8, so it's an abnormal cupping, so it's also called vertical cupping. Okay, the other signs of primary open angle glaucoma are laminar dot signs. This is due to fenestration of the sclera, are visible as gray-white dots. How they appear, laminar dot signs? Gray-white dots on the sclera. Okay, and next we see splinter hemorrhages on the optic disc surface. What are splinter hemorrhages? They are small red dots. Okay, small red dots. Next we can see the bayoneting sign. What is bayoneting sign? It's the double angulation of blood vessel. As you can see, in a normal there is only one angulation. In bayoneting sign, there are two angulation. Here is one angulation and here is the second angulation. Okay. In the retinal nerve fiber layer, wedge shape defects can be seen. RFNL layer, the wedge shape effects can be seen. This is the earliest sign of glaucoma. Okay, when you see a fundus picture, we can see the RNFL, and it's the earliest sign of glaucoma. Okay, and lastly we see peripapillary atrophy. Here in the papillary zone, there is the size reduces, so there is atrophy. Okay, there are two zones for it. One is alpha zone, which is specific for glaucoma, and beta zone, which is also seen in myopia. Okay, so to remember the other signs, we need to remember Bangalore. Okay, BLR, bioneting sign, laminar dot signs, and retinal nerve fiber layer. And last is the peripapillary atrophy. Okay, in the symptoms we can see headache, delayed dark adaptation, frequent changes in the presbyopic glasses, and scotoma. So this can be remembered by SPD headquarters. So it's S for scotoma, P for presbyopic glasses, D for delayed dark adaptation, H for headache. Okay, so that's all for now. For the next part, please subscribe to our channel and please follow us on our Telegram channel for the notes.